Good afternoon. Thanks very much for joining us again today. As usual, I will give you a run through of the daily statistics, starting with the total number of positive cases reported yesterday. That was 1,875, which is 12% of the total number of tests, and means that the number of confirmed cases in Scotland now stands at 153,423. 607 of the new cases were in Greater Glasgow and Clyde, 280 in Lanarkshire, 214 in Lothian and 162 in Ayrshire and Arran. The remaining cases are spread across 9 other health board areas. As of yesterday, I can also confirm that 175,942 people had received their first dose of vaccine. I can also tell you today that 1,717 people are currently in hospital. That's 53 more than yesterday. And that compares to a peak of just over 1,500 in the first wave back in April. So again, we can see the very acute pressure that COVID is currently putting on our hospitals across the country. 133 people are receiving intensive care, which is an increase of 7 from yesterday. And I'm very sorry to report that 54 additional deaths have been registered in the past 24 hours of patients who first tested positive over the previous 28 days. And that takes the total number of deaths under this measurement to 5,023. This is always obviously a distressing figure to report to you every day, but it's particularly distressing today because the numbers that I have just reported take the total number of deaths under this daily measurement now to more than 5,000, which is another reminder of the heartbreaking toll that this virus has taken and is continuing to take across the country. Every single death is causing heartbreak to families, friends, loved ones, and I want again today to convey my thoughts and condolences to everybody who finds themselves in that position. Now, I'm joined today, as you can see, by the National Clinical Director. He is going to talk in a moment about NHS screening programmes for conditions such as breast cancer. In doing that, he will highlight that our screening programmes are still running and anyone who has a screening appointment should turn up to it if at all possible. Those are, of course, very important messages, so if you are due to be screened, I would strongly encourage you to follow that advice. Before Jason speaks, though, I've got a few brief points that I want to update on. The first is that I have just earlier this morning chaired the weekly meeting of the Scottish Cabinet. As I indicated yesterday, one of the things we discussed was whether there are any areas, takeaway, click and collect services being 2 examples, where we think there is a need to further tighten restrictions to reduce the occasions and reasons for people to be out of their homes at the moment. We are continuing to consider these options a little bit further, and I can tell you that I will update Parliament tomorrow on any decisions that we reach over the course of the day. The second item I want to highlight is pre-departure testing for people who are travelling to Scotland from other countries. We confirmed last week that we would introduce a requirement for pre-departure testing for anybody travelling here from overseas. This requirement, I can confirm today, will come into effect on Friday morning. So anyone arriving in Scotland after 4 o'clock on Friday morning will be required to present evidence that they have received a negative test result from a COVID test that has been taken in the previous 3 days. The nature of the test will be set out in regulations, but it will need to be highly reliable. And that means in practice that the tests required will almost certainly be PCR tests. There will be some limited exemptions from the requirement for a test, for example, for younger children, but the details of who exactly might be exempt will be set out on the Scottish Government website. Now, I want to be very clear here that this requirement for testing before entry to the country is seen not as a substitute for other protections and mitigations in place, but as an addition to those. Testing before entry to the country is not a magic solution to the risk of cases being imported, so it will reinforce rather than replace our current travel restrictions. In particular, anyone travelling to Scotland from a country that is not on the exemption list will still require to quarantine, to self-isolate for 10 days on arrival. And of course, Any of these mitigations and protections should only be applying right now to a very small number of people. In short, to people who have an essential purpose to be travelling. The most important point of all I can make in relation to travel remains this one. We should not, as a general rule, be travelling in and out of Scotland right now, just as we should not be travelling freely within the country. It's only legal to travel to or from the country if you are doing so for an essential purpose. So the fundamental advice remains: do not travel right now unless you have a genuinely essential purpose. Stay at home. Now, the third issue I want to touch on is support for businesses. The Finance Secretary announced yesterday details of top-up grants that are being made available to businesses in the hospitality, retail and leisure sectors. These are worth up to £25,000 for larger premises. I can confirm today, though, that we're also making some one-off additional support available in level 3 areas. So this affects businesses in Orkney, Shetland, the Western Isles and some Hebridean islands such as Mull, Jura and Islay. As you recall, these are the only parts of the country right now that are not in the tight level 4 restrictions. And the reason to make more support available there is that in these areas, although they're not under quite as tight restrictions as mainland Scotland, businesses are often just as badly affected. Hospitality, for example, is just as affected because even although it might not be under the same restrictions, travel is restricted and therefore the impact is quite severe. So it's important that our compensation arrangements take account of that. So we will be allocating approximately £3 million to local authorities so that they are better able to support affected businesses. The latest set of restrictions I know have been incredibly tough for businesses across the economy, but perhaps particularly for those in the hospitality, retail and leisure sectors. And we remain committed to working with those sectors to help them as much as we can get through the coming months. So I hope that the announcements made yesterday and today reassure them of that commitment, as well as providing them with vital financial support. Now, the final issue I want to touch on relates to one of the ways in which we tried to track the course of the pandemic in Scotland. In August, for those of you who have been regular viewers of these briefings, you may recall that we established 2 online surveys. The surveys ask about a range of different topics, for example, how much contact people have with each other and the extent to which people are using face coverings. These surveys have enabled us to identify and respond to emerging issues. For example, knowing whether people are meeting up more often or less often is an early indication for us of whether we might see a rise in transmission rates 2 or 3 weeks down the line. We are now seeking more volunteers for the surveys. We need 3,000 more volunteers. So if you are interested in taking part, please look at the Scottish Government's Twitter feed, where you will find details of how to volunteer. I should say the surveys are not especially time-consuming. You're asked to complete one every 2 weeks, but they are a really important and really helpful way in which you can help us to understand the course of the pandemic and therefore help to inform and shape the decisions that we have to take to try to keep the country as safe as possible and steer it through the next phase of the pandemic. So I would encourage you to look at our Twitter feed now or in the next few days, and if you have the time and the inclination, although it doesn't take a lot of time, please consider signing up. You will be doing a lot to help not just the government, but by extension the whole country get through this next period. Now, I'm going to hand over to Jason in a moment, but before that, let me just emphasise again our key public health advice. The main message at the moment is a very simple one, but it is a vital one. You see it in front of me on the podium right now: stay at home. In almost all of Scotland, certainly all of mainland Scotland, apart from the islands I spoke about a moment ago, you must only leave home for genuinely essential purposes right now. That includes caring responsibilities, work that genuinely can't be done at home, essential shopping and exercise. If you meet up with someone outdoors, you should only meet with one other person from one other household. And I would repeat and underline the point I made yesterday. Going out for exercise should be that right now, not going out to socialise in a park or on a beach, particularly not going to places that might be crowded. I know that's really hard, but it is important. The stay at home rule right now is intended to stop people interacting, and that is unfortunately important outside just as it is inside. In addition, please work from home if you possibly can, and to employers, enable and facilitate your staff to work from home if you can. And of course, remember the facts advice. Wear face coverings when you are out and about, for example, doing essential shopping. I welcome some of the announcements and commitments made by some supermarkets yesterday to make sure they're playing their part in helping encourage the use of face coverings. Avoid places that are busy. That includes parks, outdoors. Clean your hands regularly, clean surfaces regularly. Keep 2 metres distance if you are with somebody from another household. And remember, self-isolate and get tested if you have any of the symptoms of COVID. All of these measures are still effective, even against this faster spreading variant of the virus, and it's really important we remember them. On the faster spreading variant, our most recent statistics suggest that that is now the dominant strain circulating in Scotland. Over 60% of cases in our most recent days have been of that new variant, using the proxy S-gene dropout test that is used. So that's why it is more important that in any occasion we are out, we are taking all of these mitigating steps. But fundamentally, the best way of protecting yourselves, others and the NHS right now is to stay at home. I cannot emphasise that strongly enough. So please stay at home, protect the NHS and save lives. I'll hand over now to Jason, and then he and I will take questions from the media.
Thank you, First Minister. So, as the First Minister said, I want to talk very briefly about screening programmes. So during the lockdown last March, we made the very, very difficult decision to pause all of our adult screening programmes. However, since the summer, screening staff have worked hard to get them back up and running again and to make sure they can be run safely. Right now, all adult screening programmes are running, both for catch-up for those who were missed during that period and for those having their scheduled regular appointments. These detect cervical, breast or bowel cancer, the diabetic eye screening programme and screening for abdominal aortic aneurysm, as well as the prenatal and newborn programme, which we didn't pause at all. All of them have appropriate infection control measures in place so you can feel confident and safe about attending. I'd encourage everyone who already has an appointment to keep it if you possibly can, and to make an appointment if you get a letter or a call asking you to do so in that regular way. Travelling to screening appointments is classed as essential travel for obvious reasons, so you can still attend your appointment even under these restrictions across the whole of Scotland. Health services are busy, as you've heard us say many times, so getting an appointment, particularly if you were postponed, may just take a little bit longer than usual, so please be patient. And as always, if you have symptoms, if you notice a lump or a bump or something changes, please don't wait for a screening appointment. Contact your GP immediately. The practices are open. They will see you. They will give you good advice. That's it.
Thanks, Jason. We'll go to questions now. Gordon Cree from STV.
Thank you, First Minister. It's just over a week now since the current lockdown restrictions came into force, and people in the takeaway food industry have been asking why they are being looked at for potential further restrictions. They wonder what the specific evidence is for that, or is it just not a good look in the big picture? And talking of the big picture, what's your feeling about where we are in terms of the big picture? We have a full lockdown at the moment, but what's the next stage of that, and where does that get to? And if I can ask Professor Leitch on vaccinations, I think the figure today suggests over 12,000 people vaccinated yesterday. Where does that fit against the pace that you feel we need to get to once the supplies are more forthcoming?
Thanks, Gordon. I will make 3 quick points and then I'll hand over to Jason, who want to say a bit more, I'm sure, about vaccination. Can I say, first of all, and I know you just use this for shorthand, so I'm not picking on it deliberately, but we don't do things and we don't restrict things because they are not a good look. We do it for reasons of how do we best stop the interactions that allow this virus to spread. And right now, so back when we had very low prevalence rates and we were dealing with flare-ups and outbreaks, the the questions around where specifically the virus was spreading were really important. And I'm not saying they're unimportant now, but when we've got high prevalence, as we do just now, and quite broad-based community transmission, what is more important is just to recognise that the virus will spread wherever people come together. So it's not about specifically saying this sector or that sector is a particular problem. It's saying, are there places, even in lockdown right now, where people are tending to come together, and do we need to do more to stop that? And takeaway, and we're not picking on any particular sector or any particular part of sectors, but if you think about right now, we're asking people to stay at home except for essential purposes, but people can still go for takeaway, still go into places for takeaway. Now, it may not be about saying you can't have takeaway at all, but do we need to tighten up how that operates just to limit the potential for people coming together inside? Click and collect as well. It may not be that we do away with click and collect, or for a period stop click and collect altogether. But if we're saying to people right now, you shouldn't be out of your home for shopping unless it is essential, then do we need to have click and collect for non-essential services instead of having that by delivery? And is restricting that just reducing again the interaction? So none of these are easy decisions, but don't forget the overall objective here, to reduce as far as we possibly can the opportunities and the settings and the environments in which people are coming together, and therefore the virus is getting a chance to spread. And this is probably more important now even than it was last March, and it was very important then because we know this virus spreads faster and is much more transmissible. So it's even more important that we cut down on those interactions. In terms of next steps, overall, and I don't want to, so if you look at our case numbers that we've been reporting over the past 3, 4, 5 days, they give me a very, very initial sense of optimism that we might have started to see a bit of a stabilisation. They're not shooting up in the, if you go back a week or just over a week, I feared that we could be in a position right now where we'd be reporting over 3,000 cases every day, because that seemed to be the trajectory we're on. We've not gone to that. We're now down around the 2,000 mark. Test positivity is still far too high and higher than it needs to be to deem a pandemic under control. But again, it hasn't gone from 10 to 15 to 20% the way we saw happen in London in recent weeks. It is around 10, 11, 12%. Now, I don't want anybody getting complacent around that, A, because it's too early to be definitive, and B, if it is the case that the restrictions might be starting to stabilise things, it's only because we've got the restrictions, and we need to keep at them to keep it like that and avoid it running amok again. But that will still, because we've still got that high level, we're going to see continued and growing pressure on the NHS for some time to come, which is why it's so important to keep it under control. Next steps, we will review the current lockdown. It's in place until at least the end of January. We haven't completed that review yet. When we do, I will set that out. I wouldn't want to raise expectations that we will lift all of these restrictions at the end of January. I think that is unlikely, that we would have a wholesale, I think it's very unlikely there'd be a wholesale lifting of these restrictions. There may not even be any lifting of these restrictions as soon as the end of January. We'll have to consider all of that carefully and set that out in due course. I'll hand over to Jason now on vaccination. One point from me on that, we would hope to see and expect to see the daily numbers of vaccinations increase as we go through the next days and weeks. We started, for two reasons, with vaccinations in care homes, firstly and most importantly because that's the JCVI top priority group, but also because of the characteristics of the Pfizer vaccine, of which we have had more of. That was how we optimised use of that. Vaccinating in care homes is a bit more time consuming and labour intensive than the vaccination programme when it gets into the general population will be. Now, we are probably about 80% through care home residents now, which is important. But as we get into community vaccination, we would see that daily rate increase. And of course, we've set some very key milestones for the groups we want to complete by the end of January, start of February, and then by the middle of February. Jason.
Yeah, quickly on both of them, Gordon. Remember what the data is we get from Test and Protect. We ask every positive case, where were you in the 48 hours before your symptoms? So that's effectively your infectious period. And eating establishments still come up in that list, quite prominently, in fact. So nobody is sitting in anymore, so that must be takeaway places. Now, is there a way of making them safer, is the question and the advice, and that's exactly what the First Minister's just outlined. And that comes up again in other places, like places of worship, like people visiting relatives, like all of those other elements which we've tried to tighten as much as we can. To your second point, and you perhaps would expect me to say this, but it's completely genuine, the vaccination programme is going better than I expected it to go. It is going really quite smoothly. Now, there will be bumps on the road and there will be variation, of course, across our 4 countries and inside our own, but it is going really, really well. The fact we have been able to vaccinate 80% of our care homes in 4 weeks is absolutely astonishing and testament to the work of the vaccinators, the health boards who have sent people out, but also to the care homes and the residents, their acceptance of the vaccine, in fact, their joy in receiving the vaccine, but also all of those who have helped us with the logistics, the pharmacists, everybody who's had to unpack these frozen boxes of Pfizer vaccine. Now, the First Minister's correct. We will speed up in terms of those numbers because we're now in GP practices. And that allows us to get our next group, which is the over 80s who live at home. That's a much more disparate group, a much larger group than our care homes, and the AstraZeneca vaccine is the key to getting them now in the next 3 or 4 weeks into the practices and into their homes, if we need to get those people vaccinated. But I'm very encouraged by progress so far.
Thanks, Jason. Alison Clark from BBC.
Hello, First Minister. Just on the click and collect and takeaways thing then, just to be clear then, is it partly then because are you getting reports of lots of queuing of these being places where people are coming together and then potentially mixing? Is that why they're of more concern to you than maybe dentists or optometrists or even recycling centres? And also with us just being a week in, you say yourself that there are signs of optimism there. There are signs that there are, some of these indicators are stabilising. What makes you think then that actually, even though there are those signs, probably more restrictions are really needed and needed now?
2 points to that latter part of your question. Firstly, I always think carefully about the balance to strike between realism and optimism. I am as desperate as anybody to see good and positive signs in these daily figures. Jason will tell you, I interrogate him and Gregor every day about, is that good sign? Is that? So we're all keen to see that, but we've got to be cautious. It takes a longer period of time than we've had to see whether what appears to be a stabilisation is actually that, or maybe just a feature of the time lags and the reporting intervals. So we have to be cautious about that. But the second point is more substantive. Stabilising at 12% positivity with around 2,000 cases a day is better than a curve in the graph that's going like that. But it's not good enough. That is a dangerously high level of transmission to have. So it's not, we cannot, even if we become fairly confident that we're achieving that stabilisation, we can't be resting on laurels about that. We've got to get transmission down. We've got to suppress this virus. That remains the priority. So are the current restrictions, in our judgment, sufficient to do that and get beyond just containing growth or even stabilising the levels, but starting to push them down as far as we can? And you've heard us have these, share these kind of judgments and deliberations with you at different points over the past 10 months. And in relation to click and collect and takeaway, it's a bit invidious. I'm not meaning to single these out to say that they are a particular problem. But yes, it's places where people, when we want people to stay at home as much as possible, are able to leave their homes. Yes, you can at these kinds of places see queues gathering, and even with distancing that can form a bit of a risk environment. So it's just looking at, remember, the foundation of our approach for this period is stay at home. Now, there are essential reasons why people have to leave home, but we should be thinking very hard about any reasons that are perhaps not essential right now, in order to be very clear that stay at home is the key thing everybody can do to try to help us not just stabilise these figures but get them going in the right direction. James Matthews from Sky.
Thanks very much, First Minister. The organisation Our Scottish Future says that Scotland's test and trace figures are the worst in the UK, 32% behind the next up, which is England, 41. Are these figures you recognise, and how big a concern is that? Also, there's chat this morning or reporting about a 3-metre social distance, wearing face masks out of doors. Are either of these things in your mind for future restrictions?
On the 3 metre, I'll deal with that first. Jason may want to say a bit more about this because it's probably the easiest bit to deal with. We've not had a specific discussion about whether we are going to go from 2 metres to 3 metres. So it's not, in that sense, it is not something that is on our immediate radar screen. It's certainly not under active consideration right now. The caveat I always inject to these answers, though, is that we are always open-minded to anything that the science and the evidence tells us we've got to do, and that if we did would be effective in reducing transmission. But we are not currently considering moving to 3 metres, and if that changes, obviously I would set out the reasons for that and any decision we took. On the point about the report today on Test and Protect, I recognise the figures only because I've read the reports of this, and I've actually spent a bit of time this morning looking into them in some detail, talking to Gregor and Jason about them. So I'm going to come on to what I think is a genuine and legitimate issue that all countries face around the difference between confirmed positive cases through testing and the overall level of infection. But on this specific, Our Scottish Future, we would take serious issue with the methodology used here to get to the specific conclusions. For example, it mixes up and compares in a way that's not really appropriate. I'll ask Jason to say more about this. Prevalence and incidence, which is just not an appropriate thing to do. If you look at the methodology, actually, you can see that it's flawed because it would imply that Northern Ireland in recent days has had a detection rate that's greater than 100%, which is clearly not possible. So we have significant issues with the methodology, which would mean we would question the conclusions about Scotland's performance here compared to others. More generally, though, we always know, and people will have heard me and others say this before, not every person with COVID in the country features in our confirmed cases because not everybody gets tested. So there is always an assumption that the true level of infection is higher than the numbers we're reporting here every day. And that is all factored into the modelling we do about what we expect to see happen, what the pressure on our health service is going to be. Now, some people will, even although they've not been tested, will be isolating because they will be a confirmed contact of somebody who has been confirmed, but there's always that gap. What we try to do to narrow that gap, and in fact, we just had a discussion with the Health Secretary and the CMO about this morning, is doing more widespread community mass testing in order to pick up more asymptomatic cases of the virus, because the asymptomatic nature of some people's virus is one of the main reasons why they don't get tested, because they don't have the symptoms and therefore they don't go for testing. So we did some pilots before Christmas, and we're now looking at doing much greater scale community mass testing initiatives, which will not completely eradicate that gap, but will help us close that gap. But Jason can perhaps give you a more expert answer than I've just managed.
Yeah, it's pretty thorough. So the first point to make about the 3 metre outdoor face coverings is, on the 12th of January, today, the consensus from SAGE and the consensus from our own advisory group is this new variant of the virus is as susceptible to the distancing and the face coverings and the alcohol gel that the old variant is susceptible to. So therefore, the advice to the general population remains the same. My understanding is a SAGE scientist suggested somewhere in the media that perhaps we might have to think about moving to slightly different versions of that. That's a completely legitimate thing to investigate, and we have expert groups looking at it all the time. New variant makes that slightly more urgent for us to be sure everything we see suggests as long as you don't drop your guard, the same things work, but you mustn't drop your guard. As to the Scotland's, whatever they're called, Scotland's Future Group or whatever they are, that they have confused two statistical elements, which I think is unfair. They've confused prevalence, which is how much disease you have in your country, which is a modelled number. You can't ever know. No country can know. So that's got big confidence intervals around it, statistically, with incidence, which is how much you have from your positive tests, how many new cases you find each day. They've then subtracted one from the other and come up with a percentage as if that is how much we find. I don't think that's fair. I don't think it's statistically correct either. But the fundamental truth is that you want to find as much disease as you can and isolate it from the rest of the community. Forgive the slightly impersonal version of that. And you do that in two ways. You do that by testing and contact tracing. We don't test every contact because we want that disease out of circulation. We want it in homes, self-isolated. And that's where we do very, very well. Our contact tracing has got very high percentages within 24 to 48 hours, and our testing results come back very, very quickly. So I'm very confident that the fundamental premise of this document, which says test and protect isn't working, is actually false.
Peter McMahon from ITV Border.
Thank you very much, First Minister. First Minister, we've asked you on several occasions about the very sharp rise in cases in the south of Scotland and the pressure that has increased on the health service in Dumfries and Galloway and the Scottish Borders. The Chief Executive of Dumfries and Galloway NHS, for example, recently used the word crisis. So I wondered whether the Cabinet had considered perhaps more local restrictions to try and deal with this, or whether your strategy now is to have Scotland-wide national restrictions, probably short of a full March-style lockdown from what you're saying. And could I ask one very specific question? Emma Harper, who's the MSP, an MSP for the South of Scotland and SNP MSP, has suggested there should be a walk-through COVID-19 testing centre in Stranraer, given the very high numbers there. She said there are similar centres in places like Gala, Wick, Oban, some of which have even smaller populations. So would you consider that?
We consider the location of walk-through centres all the time. So yes, we will consider it. That doesn't mean to say we will come to a positive yes, we will do that. We've also used extensively, and you know this from past outbreaks, we've used, as we do all over the country, but I know we've done it in the Borders and Dumfries and Galloway, mobile testing facilities. So getting testing facilities to people as close and accessible as possible has always been the approach we take, and we'll always look to see whether there is a need to do more of that. So we'll consider the Stranraer point, even if it's not a permanent walk-through centre, whether there's a need for more mobile testing capacity to be deployed there over the next period. On the question about severity of restrictions, if we were at the moment, which we're not, as we were a few weeks ago, with different levels applying at different parts of in different parts of the country, there's no doubt that Dumfries and Galloway right now would be in the top level because of the infection numbers that we see there. And that's very different to the position, you know, if I think back to late November, early December, then when what you were rightly challenging me about at briefings was why aren't they going down a level, because they were so low, and that was legitimate and right at the time. And we did put them down a level. Right now, they would justify being in the top level, but all of the mainland is in that top level right now, and it is very strict. This lockdown should be considered to be as serious and as strict as the March lockdown last year. And around the edges, as we've talked about already today, we're looking to see whether we need to tighten that up. But stay at home, except for essential purposes, is a very, very stringent and strict measure, and it's appropriate for the levels of infection we have across the country, and indeed in Dumfries and Galloway in particular, which has got one of the highest prevalence rates of all. I'm possibly mixing up prevalence and incidence as well at the moment, but levels of infection of any part of Scotland. So it's really important that people in Dumfries and Galloway hear that advice and heed that advice.
It has both a high prevalence and a high incidence. Dumfries and Galloway is an example, unfortunately, of the challenge of this virus. We stood here and got asked repeatedly why we hadn't moved Scottish Borders down, why we hadn't allowed Highland to go to level 0, why we hadn't done... This is why. Because Dumfries and Galloway went from almost no cases to the highest in the country in 3 weeks. That's the nature of this virus. However, people should be cautious in Dumfries and Galloway, but inside your question, Peter, they shouldn't be scared. The hospital both has its own capacity and we have mutual aid across the whole country. Ayrshire, Nairn, Glasgow is available for patients in Dumfries and Galloway if they need intensive care or further care inside there. They should be absolutely strict in their following of the guidance, but they shouldn't be scared that the health service isn't ready for them.
Joseph Gartley from Bauer.
Thank you, First Minister. So my point's kind of going to expand on Peter's. So we shared a video on West Southern News' Twitter page today showing a man from Dumfries and Galloway on a respirator machine struggling to breathe. He wanted to share his message that COVID is serious and prevalent in rural communities. And obviously this comes as numbers in Dumfries and Galloway, the Borders, Aberdeenshire and the Highlands begin to rise. He believes people in rural areas have become complacent with the rules. Would you agree with this? And why are we seeing more cases in these rural areas now?
Jason can maybe give a more technical answer to what I'm about to say here, but we're seeing more cases everywhere right now because transmission has risen and the overall burden of infection is higher than it has been since any point since March, April last year. And I absolutely agree that COVID is serious and people should take it seriously. I do believe, and this is not a criticism of, I think we're all a bit susceptible to this perhaps, that as we suppressed the virus coming out of last spring into the summer, it got to very low levels. I would stand here day after day reporting very small numbers of cases for a long period of time, nobody dying. And perhaps, you know, there was a sense of, well, okay, maybe the worst is past, this virus is not that serious. I remember standing here many times over the summer trying to convince people that even although thankfully we weren't seeing people dying at that stage, there were people getting ill, long COVID. And the point is, this is a dangerous, often deadly virus. Nobody should be complacent about getting this virus. Even if you are young, fit and healthy, it can make you very ill. And it can make you very ill to the extent you need intensive care. It can even take your life, but it can also leave you with pretty horrendous long-term health impacts that we don't yet fully understand because it hasn't been around long enough to have developed that understanding. So my message to everybody is do whatever you can to avoid getting this illness. I was listening a couple of days ago to some intensive care doctors from London talking about how they were struck by the numbers of relatively young people they were caring for in this wave compared to the first wave. So it can strike anybody and it can make anybody very ill. And although the chances of getting ill and dying are greater the older you are, nobody can be complacent that they are not at risk from it. So do whatever you can. Wherever you go just now, you should assume you have the virus or the person next to you has the virus and act in a way that is intended to stop it jumping from one of you to the other. So do whatever you can to stop getting it because it is really, really serious.
Yeah, I hope people listen and watch these media stories that have increased over the last few weeks. I hope they also watch them when and if we get the prevalence down to very low levels, because they are a constant reminder of why we have to keep the numbers low. And unfortunately, they're a reminder of why these restrictions are so necessary. The virus doesn't know if you live in rural Dumfries or a high-rise in the middle of Glasgow. It doesn't care where you live. It cares how many people you meet and whether it can find a new host to divide in. So that is more likely if you're in a high-rise in Glasgow, but it is not impossible if you're in a rural farm in the Scottish Borders. It is all about the protection of your front door. The most solid protection against getting this virus is the front door of your house. So only leave for exercise and other essential reasons for now, and then we'll get these numbers down and we'll get back to some form of normality.
Shona Duthie from Original 106.
Thank you, First Minister. Professor Hugh Pennington at Aberdeen University is among those calling for the introduction of quarantine hotels for people travelling here from abroad. Is that an idea that's being considered? And with the benefit of hindsight, should tougher travel rules have been in place last summer when new strains of the virus were brought back to Scotland?
I think we can all, and I've never tried to shy away from the possibility that we might have done different things at an earlier stage had we known everything we know now. I'm not saying this to be critical, but I remember earlier in last summer, Hugh Pennington was one of the people who was saying that the chances of a second wave of this were almost non-existent, and we shouldn't be worrying about that. We should be getting back to normal. So, nobody has the ability to see into the future and judge everything. Absolutely. I've always acknowledge that travel is one of the things that I'm not sure the UK as a whole and Scotland within that has done as well as we should, which is why I think as we start to suppress again to very low levels, before we start coming out of domestic restrictions, we really do think very carefully about, are we doing enough to stop the virus being reseeded from elsewhere? The genomic sequencing studies that have been done that showed that we virtually eliminated it in Scotland over the summer, but then it was reseeded. And that's just the nature of how the virus spreads. So I think it is one of the things that we have to do very carefully. And I think as we come out of this wave and try to avoid getting back into a position like this, it's one of the things that we I think almost definitely have to do more stringently than we did previously. Quarantine hotels, look, right now nobody, unless it's essential, should be travelling, and the quarantine is important. There are all sorts of, I think, practical issues around quarantine hotels. Some countries do that, Australia and New Zealand do. I think people have to pay for them themselves, and be corrected on that if I'm wrong. So there's different ways of doing this, but right now the most important message is don't travel. Don't travel within Scotland and don't travel out of Scotland or into Scotland unless you have a genuinely, and I'm going to emphasise the word genuinely, essential purpose for doing it. Katrine Bussey from PA.
Hello, First Minister. I wanted to ask if you were confident your government is doing enough to support those people who need to self-isolate. Asking this because new figures have been published this morning on the number of support grants, the £500 support grants that the government introduced a little while ago have been released. They show in October there were 3,015 applications made and 695 payments. In November, the following month, there were 3,938 applications and 1,160 payments. So over the 2 months, just over a quarter of people who applied for the grant got it. Is this an issue with messaging? Are people applying for the grant when they realistically just are never going to be eligible for it? Or is there some other problem? And how is this impacting on people's ability to self-isolate when we really need them to? Thank you.
Thanks, Katrina. So generally, before I come on to the specific, if you ever hear me stand here and say I'm absolutely 100% satisfied we're doing enough on any aspect of this virus, then email me or shout at me through email for being complacent. We should never ever assume we're doing enough. There'll be some issues where we are genuinely doing as much as is reasonably possible to do, but we should always be challenging ourselves on that, and we should always be asking ourselves serious questions about it. I didn't really mean to email and shout at me through email. You don't really have to do that. But you get the serious point I'm making. On the specific point, so obviously I can't answer the question definitively because I don't know the circumstances of everybody who has applied for the self-isolation payment and hasn't got it. My general hypothesis around that will be that it is around eligibility. So there are eligibility criteria for the grant, and there will be people who, through no fault of their own, don't know what they are and think they might be eligible when they are not eligible. And that's why there will only be a proportion of those applying actually get the payment. Now, that's the technical answer as to why that would be the case. That still raises the question, is there a group of people, therefore, who are not eligible for this grant, but who are genuinely finding it financially difficult to self-isolate? And to come back to the kind of nub of your question, yes, that is something that we continue to look at to see if we can extend the eligibility criteria were extended on a previous occasion after the grant was introduced, and we are actively looking to see whether we need to do that again. There is other support available for people self-isolating. Councils do proactive calls to people, particularly in low-income circumstances, to offer other support as well. But this is a key part of our response, so it's really important that we do continue to challenge ourselves to do more, and that includes, but is not limited to, the self-isolation support payment. David Ball from the Herald.
Thank you, First Minister. COSLA has warned that 360 million is needed this year for councils to mitigate the cost of the pandemic. They're also saying that they'll need an extra 1.5 billion in the coming budget to recover from the pandemic and to balance their budgets. I was just wondering, they're also asking for council tax rise to be no cap on that. I was wondering if that's something that the Scottish Government could consider, and what your message is for councils put under increased pressure by the pandemic. There are also reports this morning that the Microsoft fault impacting remote learning is going to take weeks to fix. I was just wondering what support the Scottish Government can do to mitigate the impacts of this.
On the points about COSLA, COSLA and our local authority partners are doing a great job just now, and they are, an integral part of our response. And, I want to thank everybody working in our local authorities for that. And also just to underline the fact that the point I'm about to make is not meant in any way to minimise the financial pressures on councils, but we are in a pre-budget period right now. The Scottish budget will be presented to Parliament later this month, so it is usual at this time for councils and COSLA to be making financial bids and demands on government, and it's perfectly legitimate for them to be doing so, but I would suggest that we perhaps see it in that context as well. And obviously these decisions will be taken in the context of the budget, and that will include any decisions around caps on council tax. We have made available to local authorities over the course of the pandemic quite significant additional funding, which has been obviously for specific purposes, but we've also made some additional funding available to councils for them to use on a discretionary basis. We also, at an earlier stage, brought forward some scheduled payments to councils to allow them to better manage their own resources. But we continue to have discussions with councils about how collectively and jointly we best manage the pandemic while we're in it, but also, of course, as we start to recover from it as well. On the point about Microsoft, the Deputy First Minister, Education Secretary, gave a brief report on this to Cabinet this morning. We continue to be in discussions with Microsoft. Microsoft have given assurances, although what you've just said to me there is something I will need to go away and check again, that this is being resolved and hopefully will be resolved soon. As I said yesterday, it is a Microsoft issue that certainly yesterday was not just affecting education or indeed just affecting Scotland. It was more general than that. And it's not an issue with GLOW, the Education Scotland resource. Apparently yesterday there were 1.3 million logins to the GLOW system, which suggests that lots of young people and their parents were taking advantage of that. But nevertheless, the Microsoft issues are clearly making things more difficult than they already are for parents, young people and teachers. So we will continue to liaise with Microsoft to try to ensure that they are resolved as quickly as possible. Conor Matchett from the Scotsman.
Thank you very much, First Minister. Just on a point of clarity to start with, we've been contacted by people who are claiming that some care homes are deciding not to administer COVID-19 vaccines in homes which have ongoing outbreaks or have recently had an outbreak of the virus. Just wondering, Professor Leitch, if you could provide the official advice to care homes and what people or family members should expect for their care home resident relations who have had an outbreak recently, and whether or not health boards are deliberately holding back vaccines in cases such as this. And First Minister, one for you, if possible. The reports yesterday in the Health Service Journal that the UK government are deliberately keeping the supply of the COVID-19 vaccine secret in terms of numbers, etc., due to concerns that transparency on supply could lead to additional pressures on manufacturers and then them deciding to divert it to other countries. Can I ask, have you been told this by the UK government, that being more transparent with daily or weekly supply figures could lead to diversions by manufacturers? And if you've not been told that, do you agree with the argument? And are you concerned about that possibility?
I'll hand over to Jason in a moment on care homes. I mean, certainly the care homes should know the guidance around this. Yes, there will be restrictions on what can be done when there is an outbreak or in the immediate aftermath of an outbreak in care homes. That's not about health boards withholding supplies. It's about the safe administering of the vaccine in a care home setting. But Jason might want to say a bit more about that. The issue about being a little bit circumspect, if I can use that language, about overall supplies of the vaccine in the UK to try to avoid pressures on the supply chain that might come from other parts of the world was mentioned in a Four Nations call last week that Michael Gove chaired as an issue that we had to be aware of, and I think it is important that we are as transparent as possible, but equally, of course, it's you know, just a statement of the fact that we are in a global supply chain for vaccines, and therefore, you know, those who are doing the procurement will perhaps want to bear that in mind. We in Scotland, and I think this will be the case across the UK, will be as transparent as we can be about supplies coming in, and of course, what is most important of all, about the vaccines being administered, which we're now reporting on a daily basis.
Yeah, it's more difficult to vaccinate in a care home that has had an outbreak, particularly if that's very recent and they're dealing with that outbreak today, for example, or yesterday. But the relationships with the directors of public health allow those conversations to happen between care home leaders and the health board to allow that to be done as safely and quickly as possible. So that should be local decision making. There's no suggestion that we're holding any vaccine back. Vaccine is available for both residents and staff in every care home in Scotland, and we want to get that done just as quickly as we can. So it will be about safety in the moment. You can imagine there's quite a lot to do. If there's a positive case, quite a lot of testing to do. So it may just be a sequencing challenge to get that vaccine in the right order, in the right place.
Tom Martin from the Daily Express.
Hi, thank you, First Minister. Just a couple of brief things, if I may. Obviously, again today, you know, quite sad numbers and fatalities, which you've referred to, and case numbers. Given that you're having to talk about or look at further restrictions, it does seem unlikely that there'll be any easing by the end of this month. I mean, what's your message to the public who, you know, getting a bit fed up with all of this? And secondly, if I may, just on vaccine rollout, south of the border, Matt Hancock has made a commitment that the vaccine appointments within 10 miles. Again, we touched upon this previously, just given some of the difficulties with rural communities. Are you able to, you know, give any guarantees about distances in terms of, you know, how far people might have to travel or go, or see a mobile unit come round their area?
On that latter point, obviously our geography is different, and we've got, you know, 1 in 5 of the Scottish population live in a remote or rural area. So, you know, it's not in all parts of Scotland necessarily going to be that simple as saying, you know, a place within 10 miles. But it does mean that we will probably make more use of vaccines being taken to people in their own homes or through mobile units. The Health Secretary is going to be making a statement to Parliament tomorrow where she will set out more of the detail of this. We've already provided, in fact, I think we did this before Christmas or just after Christmas, to MSPs maps of where the almost 1,200 sites that are operational from this week are situated across the country, to give people a sense of the geographical spread of those. And, you know, we will use mobile vaccination facilities to get to places that are obviously geographically further away. But the Health Secretary will set out more detail of that in Parliament tomorrow. But I think most people would appreciate, because of our greater remote and rural and island communities, it's perhaps a more complicated picture than it would be in other parts of the UK. My message to the public who are fed up with this is, I feel your pain. We're all thoroughly fed up, scunnered, you know, with this. But I think people, by and large, and I'm not saying I speak for everybody here because I wouldn't try to, but I think the majority just understand that we have no alternative right now, and this is something we've got to do to keep ourselves safe, to keep the people we love safe, and to help ensure that the pressure on our NHS doesn't grow to the point where the NHS can't cope with it. So I think there is a pretty grim realism in the population right now. It doesn't mean any of us are happy with it. Who in their right mind would be happy to be living through a global pandemic? So my message is, I understand I'm subject to these restrictions just like everybody else is, and we've got to stick with it. So that's stick with it. I'm not going to stand here right now and give a date as to when these restrictions will be lifted, because I can't do that, and it would be trying to just tell people what they want to hear as opposed to rooting my messages in reality. But I'll continue to stand here regularly to share the up-to-date data, to share our up-to-date thinking, and to try to navigate, taking people along with me, the course that we've got to take through this. But I know it's miserable, I know it's grim, I know it's horrible, but we've got to stick with it because it is about saving lives. And you know, that's what we've got to remind ourselves of every time we do something, or stop ourselves doing something is more appropriate right now, that we want to do. Then just think about it. We're probably in some way, it might not be immediate, but somewhere along a virus track, we'll be helping to stop somebody getting sick and helping to stop somebody perhaps dying from this. And that, I'm afraid, is what it's all about just now. Do you want to add anything to people sticking with it? Derek Keeley from the Courier.
Thank you, First Minister. I wanted to ask you about hospitals in places like Ayrshire and Arran and Lanarkshire exceeding their COVID capacity. I know Tayside is now on track to exceed its own capacity in the coming days as well. Can you tell us what kind of actions are planned to help health boards already exceeding or about to exceed capacity? And could we see any extra area-specific restrictions announced tomorrow for those health board areas?
We're not likely to see restrictions tomorrow that are geographically based, with the exception of, obviously, our islands right now are in a slightly lower level and are likely to remain so. But the parts of Scotland that are under the lockdown restrictions right now, any changes are almost certainly going to be applied across the whole country. Our hospitals, Jason will want to say a bit more about this. He's in regular contact with people managing our hospitals across the country. This is a very, very severe situation. It's more severe than any situation our health service has faced, certainly in all of my time in government, and I spent a significant chunk of my time in government as health secretary. But in general, hospitals manage their capacity in winter periods every year, and that will mean health boards using capacity across their different hospital sites. If they've got multiple hospital sites, last week we saw Greater Glasgow and Clyde do that. And it will also mean, as Jason has just indicated there, if there is a particular hospital in a particular health board where the health board can't manage the capacity within its own boundaries, then mutual aid will kick in. So that could mean a person who needs hospital care in Lanarkshire going to Glasgow, or somebody in the Borders going to Glasgow. That's how, and it's one of the advantages of having a relatively small country, that we can manage that capacity in an overall basis. But it's very, very stretched right now. And the health service will seek to manage it. The government will support them to do that. But more than at any time in any of our lifetimes, it's down to all of us to help the health service. Every time we avoid putting ourselves in a situation where we might get the virus, we are also avoiding the potential for us needing hospital care or intensive care. So we are helping the health service. And that really is something that all of us have got to play our part in.
Capacity is slightly more complicated than just the headline figures, remember. We have about 13,000 hospital beds in this country. And for planning purposes, we have to say to the health boards, in conversation with them, how many do we think we need for COVID? And then that allows us to use the remainder for all the other illnesses and all the other emergencies that we get across the year. So last winter, we had 13,000 beds and no COVID. This year, we've got 13,000 beds and COVID. So we've now got 1,500 people, slightly more than that, in hospital beds, and intensive care is already beyond baseline capacity from last winter, including COVID. So we can flex inside that. The difficulty is, it means other stuff has to stop. So cataracts, hip replacements, other things that need those hospital beds, forgive again the impersonal nature of that, require to be stopped in order for us to treat patients with COVID. So people shouldn't be scared that the health service is full or overwhelmed. It isn't. It is very fragile, and you just need to look a few hundred miles south to see what happens when it gets even more fragile, and you hear people having to limit the amount of oxygen patients can get. You see people moving to environments where intensive care is not really as it should be because it's not an intensive care unit, etc., etc. The Nightingale's reopening for inpatients, not just for outpatients. So we need to avoid that as much as we possibly can in Scotland. And again, that's the restrictions.
Rachel Watson from the Daily Mail.
Thank you, First Minister. I just wanted to ask about the vaccines again. Yesterday it was raised about the possibility of 24/7 vaccine rollout. Is that something the government would look at? And do you think there would be a willingness from people to turn up during the night to get a vaccine?
We'll look at anything and everything that allows us to get this vaccination programme done as quickly as possible. Obviously, we at the moment still have relatively limited supplies. So what we are doing right now doesn't, and the population groups that we are vaccinating right now probably wouldn't lend themselves to out of hours vaccination. But once we get into the general population, yes, if that is going to help us get through it faster, then we'll look at that. You know, we've got to make sure we've got the workforce to do that, and doing things with more shifts 24/7 would require more people because you can't have the same people working right round the clock. But this is the kind of work and thinking and modelling and planning that is ongoing in this building or wherever people actually are. They're not always in this building right now all the time. But at the moment, because of the relatively limited nature of supplies, although that's growing all the time, and the population groups, we've been focusing on care homes. So clearly, you know, that's not the same kind of issue as it will be. But once we get into the younger age groups, I think the ways in which, the times at which, the settings in which we vaccinate people become potentially much more flexible. So we don't rule anything out. We want to get through this programme as quickly as possible. We want everybody in the adult population to have this vaccine just as quickly as it's possible to bring that about. Dan Vevers from The Sun.
Thank you, First Minister. Jean Freeman said yesterday 560,000 people would have received the vaccine by the end of January or beginning of February. But we know that Scotland has to date received 560,000 doses of vaccine. So why is it going to take 3 or 4 weeks to actually administer what we've already got, especially given the target by the Health Secretary originally was 1 million by the end of January? And just the National Clinical Director, just to clarify your comments on BBC Radio this morning, is going for a walk with one other person and at some point getting a takeaway coffee during that walk while following all the guidance around distancing and face coverings and so on, would that be bending the current rules? And is there any evidence that doing that would put people at risk or risk spreading the virus? Thank you.
Jason, I'll answer that. Go for a walk, socially distance and having a coffee is not breaking the rules, but if you stay out and socialise and, you know, be out of your house for longer than the essential purpose, then that is against the rules, and it's also against the spirit of trying to restrict the virus from spreading. On the vaccine, I mean, or just on the figures, to date there has been delivered to Scotland just over 300,000 doses of vaccine. There's another maybe around 170,000 that are available, are allocated and will be flowing into Scotland over the next period, and by the end of January, we hope that we will have had 900,000 doses in total. Of the 330,000, I think it's roundabout in that ballpark that have been delivered so far, we've used more than half. Remember, of course, that until very recently, we thought we couldn't use the other half just now because we had to hold them back for second doses within 3 weeks, but they are now being made available for vaccination. And that process is underway and will accelerate, and the pace of that will pick up in the days and weeks to come. And we're setting right now, because of the logistical challenges of this, because of the fact that particularly in the early days it's the older, frailer, more vulnerable groups that are being vaccinated, we are, I think, understandably being cautious about the targets we're setting. I hope that we'll be able to exceed a lot of these targets, but I'd rather be standing here saying that we've managed to do more than we had anticipated than standing here saying, well, we promised the world, but we didn't deliver it. Make no mistake, be in no doubt that we want to get this vaccination programme completed as quickly as possible. It's not in government's interest to slow this down. It is in our interest to get it speeded up as far as is practical, because, you know, the sooner we get the whole population vaccinated, the sooner we get back to a greater degree of normality and can start to put this virus behind us. It won't necessarily have disappeared, but we can perhaps not spend every day, all day thinking about it and thinking about how we have to beat it. Jason.
Yeah, so briefly, just to put the vaccine numbers in perspective, 194 countries in the world. If you created a league table, we're second. Israel is the only country in the world that has so far vaccinated more of its population, and they've had a terrible, terrible time during this pandemic. They're into, I think, their fourth version of lockdown across Israel. The UK as a whole has vaccinated more people than the whole of Europe put together. Now, I hope that doesn't stay true for long, because I need and hope the rest of the world will vaccinate too, and the rest of mainland Europe will catch up with those big numbers. We're vaccinating just as quickly as we can. We do not have 560,000 doses in fridges because we're lazy or because we're not working hard enough. It's important that the population realise it's in our interest and theirs to get that vaccination done as quick as we can. What I said on the BBC this morning was that going for coffee and sitting on a bench with your friends was probably not in the spirit of the rules. It is, of course, allowed if you go out for exercise with somebody from your own household or one person from another household, and you pick up takeaway coffee in a safe way, maybe not in a big long queue where you meet other pals. That is permitted. That is legal. What I was suggesting was, in an illustrative way, to try and stop people thinking these restrictions are about increasing social activity. They're not. They're about exercise, essential travel only.
I think we should all, last March, April, and it's understandable why we're all in a different headspace right now, because it's been a long, long time. But I think last year we were all thinking much more about how do we keep so well within the rules that we really minimise the chances of this virus spreading. I think now there is more of a tendency to think, how do we get to the very edge of the rules to maximise what we can do? I totally understand that, and believe me, I'm susceptible to that myself. But that's probably not the way we should be thinking about it. We should still be, how do we keep within not just the letter of these rules, but the spirit of these rules? Because the virus, going back to Jason, always says the virus doesn't care if you live in this area or that area. The virus doesn't care if you're just keeping within the rules and no more. It will still infect you if it can, and it's more likely to be able to if you're at the edge of the rules. What we need to do to stop the virus is to stay as far within these rules as we can and keep well within the spirit. And think, what I would say to people is the rules are in place to facilitate all of this, but every day what you should be thinking is not what's allowed within the rules or not. What you should be thinking of is what am I going to do today, and what opportunities is that given the virus to spread, and how do I take away as many of these opportunities as possible? And I think if we all come at it from that perspective, as opposed to what can I get away with within the rules, then we're going to be much more successful at limiting the spread of this and getting the numbers going in the right direction. Simon Johnson from The Telegraph.
Thank you, First Minister. Just a couple of questions, just following up on Dan, really, on the speed of the vaccine rollout. Firstly, to Professor Leitch, can you tell me what the average time is at the moment between a dose of the vaccine arriving in Scotland and it actually being injected into someone's arm? And to the First Minister, you've said before that you're not planning to do any mass vaccination centres until next month because of supply issues, but 7 opened in England yesterday. And also down there, they've told GPs that they can limit routine work to get things moving a bit more quickly. They've published a 47-page plan that includes some quite innovative ideas to speed things up as well. And I just wondered what you would say to concerns that they seem to be ahead of the game in terms of putting in place the necessary building blocks to really ramp things up when the supply becomes available. Thank you.
I don't think that's the case. I genuinely don't think that's the case. Jean Freeman will make a statement to Parliament tomorrow. She'll publish the latest version of our delivery plan, and I think you will see the same kind of approach being taken, with some initial differences that I've alluded to already, and I'll talk about, and some differences because of the nature of our geography. I've heard and remember the structure of the NHS is different in Scotland and England, so some of these figures may not be as comparable as they sound at face value. But I've heard the Prime Minister in the last week talk about, as of this week, there's more than 1,000 vaccination sites operational in England. Well, there's more than 1,000 operational in Scotland. Our geography is different, so in some parts of Scotland, it has to be more local, smaller-based centres because that's the nature of the population spread. When we get supplies to the level where we can utilise mass vaccination centres, they will come on stream. They're being identified. Some of them have been identified. Those plans are ready to roll. I know there is always, from both perspectives, so it's not intended to sound partisan in any way, and definitely from sections of the media, to see this as a competition, and maybe a bit of healthy competition around this is not a bad thing because it makes us all run faster. But no government wants anything other right now than to go as fast as we possibly can. The reason why in the initial days there's perhaps a bit of an apparent difference in pace is what I said earlier on. We started in care homes because the JCVI told us to start in care homes, and it just takes a bit longer to vaccinate in care homes because you've got to, and also this is a feature of the Pfizer vaccine where you've got to get it there. There's lots of logistical issues around unpacking it and downpacking it and using it and such like. So that is a bit more labour intensive and therefore a bit more time consuming. Once, as we have this week, we get into the community-based vaccination, that picks up pace, and I think those differences will no doubt be differences from time to time depending on different factors, but we're all going at a pretty fast pace and that pace will pick up. For some of these reasons, I'm not sure. Jason often can answer questions that I don't think are capable of being answered, so I will give him the opportunity. But I don't think you can say what's the average time from a dose arriving to getting into somebody's arm, not least because the issues around the delivery of Pfizer and AstraZeneca are so different, and the storage things are so different, and the different settings in which we've been vaccinating will make that different. But I'll hand over to Jason, and who knows, he might be able to give you a specific answer to that.
He can neither answer the question nor make up an answer, Simon. I've been waiting for this question, actually. I thought it might be time, I thought the first time I get asked it might be time from factory to arm, but you've at least asked time of arrival in country to arm. I can't tell you the exact time for that for multiple reasons, which I think you understand about the nature of the virus, the nature of the pack, the nature of holding some back for that second dose, which we're no longer doing in the same volume that we had to, and the nature of the delivery, because if you want to go to a 30-person care home, that's a very different thing from going to the Queen Elizabeth Hospital and vaccinating thousands of people very, very quickly. So I can tell you my answer to your question is fast.
I think even if we ever could answer that question, it wouldn't be meaningful because the average would just incorporate so much variation that it wouldn't be meaning. It might make for a nice headline in a newspaper, but it probably wouldn't tell anybody anything that was particularly helpful to them. Lastly, Mark McLaughlin from The Times.
Good afternoon, First Minister. Maybe one for Jason. Back to the Our Scotland's Future report. Now, yesterday, independently of that report, Mark Woolhouse, the Scottish Government advisor, reached a very similar conclusion. He said on Newsdrive last night, "We have got a lot of data now that said that we are only finding half or even less than half of the cases. That's like fighting the epidemic with one arm behind our back. The mass testing that has been rolled out in England certainly will help with that. But if we can do something similar in Scotland, we will find a lot more." Now, you took issue with the methodology of the Scotland's Future report. Do you recognise the methodology of Mark Woolhouse, who says we're finding less than half of cases?
Let Jason answer this question substantively, but I tried in taking issue with the methodology and I can never remember what it's the Gordon Brown think tank, Our Scotland's Future, or whatever it's called. In taking issue with the methodology that led to a particular conclusion was that Scotland was doing less well than other countries. I tried in answer, I think it was James Matthews' question, to say yes, there is an issue here in all countries. And Jason explained it much more technically than I could. And that's why we are doing more asymptomatic testing. We have done mass asymptomatic testing pilots, and we are now taking the learning from those to do them more generally. And as I think I said earlier on, we were discussing that just this morning. I think there's different opinions about the success of the biggest one that was done in England and Liverpool, but that's by the by. We are doing these things in Scotland, and we will continue to try to identify as many cases as possible, but recognising that it is never going to be possible to identify all cases because of the nature of the virus. So it's not, I wasn't trying to say there isn't an issue here. I was simply saying that the methodology used in this to show, I don't know whether that was its intention, that there was a particular issue in Scotland is not a methodology that we think stands up to scrutiny. I don't know whether Mark was using a particular methodology, so I can't say whether I agree with that or not, although Mark's a very respected academic and somebody who's, of course, on our advisory groups, I would listen carefully to him. But if what he was describing was the general issue here, I of course, would recognise that, as indeed I did in my earlier answer.
Yeah, I didn't hear Mark either. I imagine what he was saying was that we get positive tests in less than half of the prevalent disease. That's of course true. That's true in many countries. I know for sure that Northern Ireland don't get 110% of their positive cases. That would be impossible. But his basic principle is true, and I think I accepted that when I answered the question earlier, that we want to find and isolate as much disease as we can and self-isolate those people. Testing is only part of that equation. You're never going to find the virus when it's incubating. You're never going to find the virus before people shed the virus, and that's why contact tracing and isolation is such a key public health intervention. That doesn't mean we shouldn't do the testing to the absolute best of our ability, Mark. And asymptomatic testing takes on an increasing role as the pandemic moves through. We've got examples now in the world of Slovakia, of Wuhan, of Liverpool doing massive population testing. And we've got examples of places like Scotland doing very targeted asymptomatic testing in high prevalence areas. The combination of those two things, the study of them, take us to a position where now we're going to think again about what we can do for asymptomatic testing. It's pretty obvious you should do it perhaps where people are meeting, workplaces, where people have high prevalence, Dumfries and Galloway, the call for testing in Stranraer, for example, earlier. Things like that seem to make much more sense, where you can find as much positive disease as you possibly can. So the fundamental principle of what Mark says and what that think tank says remains true. Find the disease, isolate it.
Maybe my last point, this is the last question, so it'll be my last point as well as an addition to my and Jason's answer to Mark. You know, some of the questions today, and this is right, and I think I made a comment earlier on that actually, particularly when it comes to vaccines, some competition might be healthy because it forces us all to go as fast as we can. But a couple of the questions today have been around, is Scotland doing less well than other parts of the UK? And I should say, firstly, all countries are struggling with this pandemic, certainly all countries across the UK. So none of us are, you know, sort of in a position where we can say we're getting everything right, obviously. There's different factors in different parts of the UK, just as I've been talking about different geographies, Scotland versus others. And thirdly, of course, this is a severe second wave for every country across the UK. But if you look at any graph right now of the progress of this pandemic in the UK during the second wave, and we shouldn't be complacent about this, because as we've demonstrated with Dumfries and Galloway, I could be standing here this time next week and this could be the opposite of what I'm about to say. But so far, on any graph, you'll find Scotland with, relatively speaking, the lowest incidence and prevalence of all the UK nations. And I only say that to make the point that, you know, maybe while we're not getting everything right and we can't be complacent, maybe we are doing some things right along the way. So that's a last point just for some important context. That completes the questions today, and thank you to the journalists for joining us. Thanks to Robert for our interpretation, and of course to Jason for helping me answer the questions. And thank you to all of you for joining us. Just to pick up on a question that was asked earlier on about everybody being fed up with this. I do know everybody's fed up with this. We are all fed up with this, but it is really important that we do stick with it. And that means staying at home as much as possible. And maybe just to underline a point I made in an answer earlier, every morning when we get up just now, we should not be asking ourselves, how do I just stay on the right side of the rules and push that as far as possible? We should be asking ourselves, how do I make sure I go through my day giving this virus as few opportunities to spread as absolutely possible, and stay as far within these rules as we can. And that means staying at home just now as much as you can. Unless you've got a genuinely essential purpose, please stay at home, because it does protect the NHS and it does ultimately save lives. Thank you very much for joining me and Jason today. I will join you tomorrow, I think at the very slightly later time of 12:20 from the Scottish Parliament, where I will update you on the daily figures, also set out any decisions that we reach in the course of today about tightening of the restrictions, and then there will be the weekly session of First Minister's questions after that. So I will see those of you who can join us tomorrow, and I'll be back here at the usual time on Thursday. Thanks very much for now.